Hello, my name is Cafrey and I'm a pharmacy student that will be presenting on Humira. First, I want to go over the patient consultation. We want to consult patient about the side effects that comes injecting Humira. These side effects include injection site pain, headache, abdominal pain, and back pain. These side effects will improve over time and make sure to inform the patient to rotate around the injection site to prevent lipoatrophy. Also, educate patients to report any adverse events, including congestive heart failure, neurological or autoimmune disorder, or cytopenia. Instruct patient that the injection has latex material. And last but not least, educate the patient that the risk of lymphoma and malignancy. Now, we're going to go over how to administer Humira. If stored in the refrigerator, please allow to warm up at room temperature for about 15 to 30 minutes before administering to provide a comfortable injection. While the medication is warming up, find a suitable subcutaneous injection site. The abdominal area is a great site about 2 inches away from the belly button. Alternative will be the upper thigh area. Now, so once you find a spot to inject yourself, swab the injection site with alcohol wipes. Following the diagram on the left, we want to remove the caps that are number 1 and number 2. Remove cap 1, which is the injection site, and remove cap 2 afterwards, which is the plum color. Place the pen on the 90 degree and then push the plum color trigger. Watch the yellow indicator like on the right diagram on the side window until it completely stops. So once it stops, quickly discard the pen to a sharp container. So we are going to transition about some information about Humira. So a very brief introduction about Humira. So Humira has been FDA approved back in 2002. Humira has been a top-selling biologic drug for the last year, reaching nearly $20 billion in sales in 2018. However, the sales peak in 2018 has been declining in sales ever since, as the patent expired early in 2023. There are biosimilar products that are coming up in the market and will provide alternative to Humira brand name. Now, we are going to go over the mechanism of action of Humira. Before we go over the MOA, I want to give an oversimplification of inflammatory and immune response. TNF is a natural occurring cytokine that plays a big role in inflammatory and immune response. Humira is a fully human monoclonal antibody that inhibits TNF alpha, and this will block the interaction of P55 and P75 TNF cell receptors. This interaction will cause an inhibitory effect that prevents an inflammatory response. Humira has 8 FDA-approved indications. It is used to treat rheumatoid arthritis, juvenile idiopathic arthritis, psoriatic arthritis, hidradenitis suppurativa, ankylosing spondylitis, Crohn's disease, ulcerative colitis, psoriasis, and uveitis. Dosages varies depending on the indications. Here in my table, we'll summarize the dosage starting with rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, which is 40 milligrams every other week. For juvenile idiopathic arthritis or pediatric uveitis, the dosage comes like this. In about 10 kilograms to less than 15 kilograms is about 10 milligrams every other week. Now, 15 kilograms to less than 30 kilograms, it will be 20 milligrams every other week. The third one will be 30 kilograms and greater, will be 40 milligrams every other week. In terms of the Crohn's disease, the dosage comes like this. 160 milligrams on day 1, given in 1 day or split over 2 consecutive days, or 80 milligrams on day 15, and 40 milligrams every other week starting on day 29. For UC, dosage starts on 160 milligrams on day 1. Similarly as Crohn's disease, can be given in 1 day or split over 2 consecutive days. The other one is 80 milligrams on day 15 and 40 milligrams every other week starting on day 29. Discontinue patient without any evidence of clinical remission by 8th week. Now, second to last will be the plaque psoriasis or adult uveitis. The dose is pretty straightforward, which is 80 milligrams at the initial dose, followed by 40 milligrams every other week starting on 1 week of the initial dose. Lastly, which is the hidradenitis suppurativa, on day 1, it will be 160 milligrams, can be given in 1 day or split over 2 consecutive days. On day 15 will be 80 milligrams, and day 29 and the subsequent doses will be 40 milligrams every week or 80 milligrams every other week. Now, adverse events include serious infection. These infections are opportunistic infections, and these are due to bacterial, mycobacterial, invasive fungal, viral, parasitic, or other opportunistic pathogens, including aspergillitis, blastomycosis, and candidiasis, and so on. Avoid using with Humira as it will increase the likelihood of developing serious infection. It should be avoided patient that has history of cancer other than non-myeloma skin cancer. It has been reported that patients have a higher risk of developing lymphoma and leukemia. Third, if patient has any serious reaction, including intense rashes or any anaphylactic reaction like swelling on the tongue or any inflammation in general. Fourth, use of TNF blocker, including Humira, may increase the risk of reactivation of hepatitis B virus in patients who are chronic carriers of this virus. Fifth, cases of worse congestive heart failure and new onsets of congestive heart failure has been reported with TNF blockers. Also, it's been associated with rare cases of new onset exacerbation of clinical symptoms, including multiple sclerosis, optic neuritis, peripheral demyelinating disease, including the Guillain-Barré syndrome. Also, cytopenia, example for thrombocytopenia or leukopenia. I want to add the Humira may result in the formation of autoantibodies and rarely in the development of a lupus-like syndrome. Lastly, I want to go over some drug interaction. 4 main classes that we want to be cautious about: methotrexate. Humira has been studied in rheumatoid arthritis patients taken at the same time with methotrexate. Although methotrexate reduced the apparent Humira clearance, but the data do not suggest the need of dose adjustment of either Humira and methotrexate. As mentioned earlier, extra careful combining the other biologics. In clinical studies in patients with rheumatoid arthritis, an increase of risk of serious infection has been observed with the combination of TNF blockers such as Humira with other treatment of Humira or abatacept with no added benefit. Therefore, the use of Humira with these agents is not recommended in patients with rheumatoid arthritis. Also, do not administer any live vaccines on Humira. And lastly, initiation or discontinuation of Humira in patient being treated with CYP 450 substrate with a narrow therapeutic index, such as warfarin, or drug concentration of cyclosporin or theophylline, is recommended, and the individual dose of the drug product may be adjusted as needed.